And a little further west last night, Bahamians dressed in their finest for a night of fun, but also to support an even bigger cause. As the Sir Victor Sassoon Bahamas Heart Foundation hosted the 54th annual Heart Ball, where Reverend C.B. Moss was presented with an award for his services, one he shares with his wife. The ball was held at the Malia Nassau Beach Resort. The Heart Foundation, through the efforts of its supporters, has been able to provide surgical interventions for more than 4,000 Bahamian children suffering from heart disease. Heart Foundation Chairman Ari Barnes says the organization currently has about 7 children awaiting surgery, and the Heart Ball helps children like them to go on to live fruitful lives.
It is our biggest fundraiser, and it'll raise several $100,000, but we have 3 children right now that are almost $250,000 that their surgeries will cost. So it disappears pretty quickly. So once again, we count on the public to come forward and make up that difference. So we make sure that we never say no to a child who needs our help. We have not had to face that. It gets pretty close sometimes, and suddenly someone will come through at the last minute. It's like God's looking down on us and smiling or something. But no, it's one of those things where we count on the public's support, and miracles happen and they seem to come through.
Trustee and pediatric cardiologist Dr. Jerome Lightbourne says with about 4,000 to 5,000 live births yearly, there are 40 to 50 new heart patients annually. While those numbers have remained static, he says the complexity has increased, starting with the cost of care, increasing the importance of the Heart Foundation.
Surgery used to be about $2,500 a case way back in the 60s, 70s. Now we're talking about an average cost of $75,000 per case in the United States. Fortunately, when we did initial surgery in '95 and early 2000s, when Dr. Reese and myself and Dr. Sands, our current Minister of Health, worked very well together, we were able to do cases for like $5,000 to $10,000. That's amazing. The United States have gone up. When I say up, I mean complexity of cases gone up, which means instead of having the same simple hole in the heart like a VSD, interceptor defect, or narrow vessels, we now have a lot of kids born with single ventricles, large holes in the heart, high pressures in the lungs. Of course, that costs more money.